The reason I'm talking about bedside teaching is that the microscope, teaching under a multi-head microscope, is akin to bedside teaching for pathology, where the teacher actually navigates the slide along with the student under the microscope and actually teaches them cell by cell. And that is a great learning experience for students of pathology. And the digital pathology and whole slide imaging is nothing but a new age multi-head microscope. You could say like a Medusa, a microscope with 100 heads. So if you look at the classic multi-head microscope, and this is a very, very sophisticated one. Not many of us have even seen such a microscope. It has 20 people sitting all huddled together, definitely a no-no during this COVID season, seeing the same slide and being taught together. Now, but you have to remember that they have to be physically present at one place for this teaching to occur. Now, what happens in the digital microscope is quite the opposite. And these are my wonderful colleagues, and mostly women, one young man out there. And you can see that they are all physically separate in their own class, in their own cabins or at their home or wherever. And note that they are seeing the same image under the microscope. So we are discussing the same case sitting at different points in time. And this is the beauty of digital pathology. All you need is, of course, very good internet connectivity and a good screen, and you will be able to actually see the image, discuss with your colleagues, and do everything at the same time. So this is what is a wonderful thing about digital pathology. And the teaching which is planned would be in modules, and each module could be 4 to 5 sessions. And these modules could be tailor-made mainly for pathologists in training, mainly for students of pathology who don't have access to many cases, many slides, expert systems, and so on. And that is one module. And the other could be, we could have teaching for other specialties like surgery, oncology, super specialties like nephrology, GI, and so on, all of whom require expert pathology teaching. And of course, undergraduates, actually, they, in my opinion, don't learn enough of pathology. And by introducing them to this wonderful digital microscopy, definitely more of them would get interested and they would learn the right things in pathology. So this, I strongly believe that to whom much is given, much is expected. And we at the Apollo Group are, like Sushma says, uniquely poised because we have all of the requirements, like a very large number of senior consultants with subspecialty interest in teaching, a huge workload which covers all specialties with a variety of cases, common and rare, the whole slide system, and an online education portal which is already functioning very well, as you have heard, that is the Medvarsity system. So education is the future, and I will just in the next 2 minutes actually show you live how we actually would be doing the education. And this is just a case which I have selected for you, just to show how beautiful. It's just labeled digital path so that the patient identifiers are not there. And this is a very, very low power, a power 0.1x, which is something you can never show your student. And just by using the wheel of the mouse, you can just zoom in and out, and you can see that this is the endometrium, and these are endometrial glands which are small, and you can show them the architecture. See, they're uniformly spaced, they are tubular, few branching, and as you keep zooming out, you can see the cells, they are columnar, just a single row of cells. You can see the stroma, and that is hemorrhage. So you can tell this is a normal proliferative endometrium, which is very, very fascinating for students if you just show them these wonderful images, and they can be shown how to contrast it with yet another case where you can see this is again endometrial tissue from another woman with problematic bleeding, and you can see what a maze of glands these are. These are multiple branched glands. They are certainly abnormal, that's for sure. And then you can even zoom on in higher power and see these columnar nuclei. are they? And this is at 20x, and you can go to 40x,
40x,
and you can
and you
do a
can do a
digital
digital
zoom to a
zoom to a
higher
higher
lens,
lens,
and you
and
can
you can
see
see
the
the
multi the multi-layering, the abnormality, the mitoses, and so on.
so on.
And
And
depending on
depending
these
on these
features,
features,
we
we
could
could
tell
tell
them,
them,
is it just hyperplasia? Is there atypia? Is there malignancy? And so on. I wouldn't want to complete this thing without showing you one of my favorites, which is the renal biopsy, because not many people get interested unless they actually see these beautiful images of cores. And even for the lay people in this audience, you can see that these are glomeruli, these are completely sclerosed. This is one where the matrix, that's this positive magenta material, is so much more. So these are things which students, even undergraduates, probably never see in their lifetime because they are not shown. And this is something we can show them just sitting in the comfort of your office and they in the comfort of their classrooms. And these is all tubules which are completely gone, so thick, so atrophic, so many lymphocytes out there, which is certainly very abnormal. And again, the vessels are very, very abnormal. Look at this vessel here. They're very, very abnormal. These are the normal tubules. These are the atrophic. Sorry, I sort of spent a little time going through this, but this is what you would see. And you can do various digital tools like this by just panning it down, up, sideways, and so on. So this is a wonderful tool which we can very, very nicely use for education in our country where resources are limited, and we could use it very, very effectively. And with that, I sort of end my session, and thank you very much for this patient hearing. And thanks to all.